Hi, everyone, and welcome to another episode of Healthcare Unlocked. My name is Kimberly, and we're excited to have you join us today. On today's episode of Healthcare Unlocked, we will be discussing chronic kidney disease. And for those that might be wondering, what is chronic kidney disease? Well, today we have a special guest, Dr. Serge Balmir, who will be providing us some insight on this topic. Dr. Balmir, welcome.
Thank you. Good afternoon, everyone.
Before we start discussing this important topic, can you tell us a little bit about yourself and your background?
I've been in practice for about 21 years. I completed my fellowship and residency at Jacoby Medical Center in the Bronx. So the kidneys are involved in so many processes in the body that as they start to fail, have problems, a lot of other organ systems also feel the effect. Unfortunately, it's a very common thing in the United States. About 1 in 7 people actually have it, and most people don't even know they have a problem.
Okay. Is chronic kidney disease something that affects all ages, or is it to a certain?
It can affect anyone, but some people are more at risk for having chronic kidney disease. People over the age of 60, people who have high blood pressure, diabetes, people who take a lot of sometimes over-the-counter medications like what we call NSAIDs, ibuprofen, Motrin, Aleve. Some people have infections that cause them to have chronic kidney disease. So there are many causes that can happen, but age is not necessarily a guarantee that as you get older, you're going to have chronic kidney disease.
Okay.
In our country, a big cause of chronic kidney disease is diabetes. Many people in the United States have diabetes, and especially uncontrolled diabetes leads to damage to the kidneys. That doesn't happen quickly, but it happens over time. And it's very hard to reverse. High blood pressure and other common reasons for chronic kidney disease. People who have had immune issues. People who have things like lupus. There are people who develop cysts in the kidneys, where genetically they're predisposed to have cysts that take over their kidneys, disease they call polycystic kidney disease or adult polycystic kidney disease.
My father actually suffers from kidney disease. And one time, because of the lack of water that he was drinking, he actually ended up in the hospital. Is this something that can happen? What are some steps that we can take to prevent, from actually ended up at the hospital with chronic kidney disease or prevent kidney disease in general?
So people who have chronic kidney disease, their kidneys are not normal. So something simple as dehydration can really push them over and make them much worse very quickly, as opposed to someone who has normal kidney function. Things you can do to prevent chronic kidney disease: if you have diabetes, good control of your diabetes; if you have high blood pressure, controlling your blood pressure, watching your salt intake, and avoiding certain over-the-counter medication that can hurt your kidneys. But very importantly is really seeing your doctor from time to time and just asking about your kidney health.
So we said some steps that can be taken is following up with your PCP, making sure your high blood pressure is under control, and diabetes, correct?
Yes.
Are all chronic kidney disease the same?
No, people get there for different reasons. Different diseases can cause chronic kidney disease. And chronic kidney disease really, when your kidney function is abnormal below the normal level for a period of time, usually about 3 months or more. People can have chronic kidney disease, they lose a kidney, and they can lose function to their kidney. So people who donate a kidney, sometimes they can have decreased function when they test the blood work, and over time they're diagnosed with chronic kidney disease. If you exercise excessively, you become dehydrated, you can cause yourself to have an abnormal kidney function. And if it's not treated appropriately or on time, sometimes that can lead to you having chronic disease to your kidney.
Okay. And what are the stages of chronic kidney disease?
There are 5 stages. First stage is very mild. You could get there very easily if you have diabetes, high blood pressure over time. Sometimes your numbers could fluctuate. Stage 2 is also mild, and again, nothing you're going to feel. Most people in the United States fall into stage 3. Less than 10%, but it's still a lot of people in the United States if you take in with the population. Stage 4 is what we consider a severe kidney disease, and at that time you can start having some symptoms related to chronic kidney disease. Stage 5 is the last stage, and most people at that point do have some symptoms, don't feel well, and there's discussion about doing other things like dialysis for them.
Can someone pass away from suffering from chronic kidney disease?
Absolutely, because the kidneys are so involved in maintaining someone's health that as they fail, other things go wrong. You can start retaining water, you can have trouble breathing, your heart can be affected, your electrolytes can be thrown off, and when that happens, sometimes your heart doesn't tolerate that very well. You can die of sudden cardiac death. You can basically lose your ability to process the oxygen in your body and become what they call hypoxic, have low oxygen levels, because you're not taking in enough oxygen because you're full of water.
Oh, wow. So chronic kidney disease can develop other side effects that can lead to
Yes.
worse health condition. Oh, wow. That's interesting.
Even high blood pressure can be very affected as your kidney disease gets worse. And sometimes people have strokes from that or heart attacks.
But not everyone who suffers from chronic kidney disease needs to get dialysis, correct?
No. Since many people fall into stage 3, you could live a long time with stage 3, even stage 1 or stage 2. But kidney disease can progress over time. Even if you do all the right things, you can still see some progression. So it's not something that you can just have and never follow up on, because it can get worse. And our goal as nephrologists is to slow that process down through medication, education, and follow-up.
Okay. Well, is there any advice that you would give to anyone who's suffering from chronic kidney disease?
One, follow-up. So it's not always enough to see your primary care doctor. You should ask to also see a nephrologist to make sure that things are being done appropriately and that you're getting the appropriate medications and recommendations to maintain your kidney health as best as possible. If you have diabetes, to control the diabetes as best as possible. High blood pressure, you need good control. And if you do have other diseases that do affect the kidney, that you will follow with those appropriate specialists. For example, if you have lupus, it's a good idea to follow up with a rheumatologist to make sure that you're getting appropriate care and different medications are prescribed appropriately.
Okay, so pretty much chronic kidney disease, it's usually a family history trait. Is it genetics?
Not always, but there are some diseases that you can attribute to family history. As I mentioned before, people can have cysts in their kidneys. So some people have cysts that just overwhelm the kidneys and affect the function of the kidneys. If you ask the person about their family, they can possibly mention that someone else in the family, they had some hearing issue or had went on dialysis at an early age or died early in life from having a kidney disease.
I see here on our PowerPoint that it lists obesity. Is that also a risk factor?
Obesity is a risk factor for kidney disease. And sometimes carrying the extra weight, not watching your diet, gaining weight, sometimes that can affect your blood pressure or give you diabetes, and that also adds more risk to developing kidney disease.
Okay. And what would you say are some of the symptoms of disease?
Unfortunately, some of the symptoms of kidney disease mimic other diseases as well. Fatigue, nausea, vomiting. Some people just will sleep all day. People can start having tremors, a loss of appetite. So things can be very subtle. But some of the more serious symptoms can be seizure activity, shortness of breath, disorientation, confusion, things that could end you in the hospital, bring you to the hospital much sooner.
So how would you diagnose chronic kidney disease?
There are a few routine tests that primary doctors will do. One test is called a creatinine level. It's a simple test. It's very commonly done. And if you fall outside the range, and usually for us, the lab will flag as abnormal. If your kidneys are working approximately less than 60% of normal, that'll flag as abnormal on a blood test.
Okay. And what are some of the treatment options or medications that can be used to treat this condition? So
again, treating the underlying disease makes a difference. So if someone has diabetes, you want to get the diabetes under control. There are many options for diabetes control, especially these new drugs that have come out that help with weight loss. And by losing weight, you also help to control the diabetes. High blood pressure medications. There are many options out there. So if someone has an issue or a complication from one medication, there's always another option to try. So getting the blood pressure under control helps to control kidney disease. There are also other drugs that have come out recently. You've seen commercials for them, Farxiga or Jardiance. They're called SGLT2 drugs, and they have been shown to reduce the need for dialysis over time or extend the time someone might need dialysis by helping to sort of allow the kidneys to process, to filter better, and to sort of give protection outside of simply just treating the kidney disease, where people have less complications in life from their kidney disease. These are medications usually prescribed by endocrinologists that treat the diabetes, but the nephrologist will prescribe them as another option for treating kidney disease. Of course, other treatments include hemodialysis or peritoneal dialysis. So these are for people who entered stage 5 kidney disease. They have symptoms and their kidneys are functioning so poorly that their body's unable to process the waste the body produces. So therefore, they're given what we call shunts in the usually in the arm, or if they do peritoneal dialysis, it's a catheter that's placed in the abdomen. And these are different ways of someone getting a treatment that allows the waste to be eliminated from the body, and this allows them to live longer, even though their kidneys are failing. And those that are fortunate enough to receive a kidney transplant, they can even live even longer than that as long as the transplant continues to work.
What are some of the dietary changes that one person can make so that they can improve?
What I usually tell my patients is that anything that's really good for the heart is also going to be good for the kidneys. So a low salt diet, low cholesterol diet, avoiding processed foods, especially foods that are packaged to be microwaved. Sometimes they contain a lot of sodium and other ingredients that are not good just for the body in general. And if you do have kidney disease, there are certain foods you have to avoid high concentrations of those foods, things that carry a lot of potassium or phosphorus, because your body doesn't eliminate those things as your kidney disease advances. And when those elements get really high in the blood, they can cause other symptoms.
Okay. Is there any advice that you would give anyone who's suffering from this condition?
In general, I would tell people that when you see your primary care doctor and blood work and urine is taken, that you should just ask your doctor, how are my kidneys? Asking simple questions. Do I have any blood in my urine? Do I have any protein in my urine? What percentage of my kidneys working? If anything sounds off, you should ask for a review of your lab results, possibly ask to see a nephrologist for another opinion or just a discussion to see what you can do to improve your kidney health. If you do have chronic kidney disease, it's important to continue your medications and have appropriate follow-up to discuss your results and to make sure that things are still progressing smoothly and you're not advancing to the next stage.
Okay, well, thank you for that informative presentation. Now let's open up the floor for any questions. If you have any questions, please leave them in the comment box. So the first time I experienced chronic kidney disease was when my father, he ended up in the hospital, and I'm like, oh, from dehydration. I didn't even think that was possible. And it was affecting his kidneys.
Usually if it's just dehydration, people will get better. But if they have underlying problems with their kidneys, sometimes it takes a lot longer. Oh, I didn't mention also smoking. If you have chronic kidney disease, smoking should be a no-no.
So we did get a question from the audience, and it's, what resources or support group do you recommend?
There's a website called NKF, National Kidney Foundation, and they have a lot of tips about kidney disease, a lot of articles that they explain different stages of kidney disease. They have dietary recommendations, even if you're on dialysis. They offer recipes and other things to avoid to maintain good kidney health. It's a very good resource for kidney patients.
Okay. Another question is it true that many of the diabetic patients we see in urgent and primary care have chronic kidney disease?
Yes, it's very common, and sometimes the endocrinologist will see it first because of the testing that they do. They'll be the first to see that there's some protein in the urine, and that'll prompt a referral to a nephrologist, or at least prompt the endocrinologist to start other medications to start to treat that process. Some very common medications we take now for blood pressure can be given to treat people who have chronic kidney disease and protein in the urine.
Okay. So Dr. Balmir, thank you for sharing your expertise and addressing our audience questions. If anyone has further inquiries or needs more information, please feel free to reach out to us at Durrell Health and Wellness or Mount Sinai. Oh, we actually have a few more questions.
Oh, sure.
How do lifestyle factors like stress, sleep patterns, and mental health influence the progression of chronic kidney disease?
I don't think they're necessarily directly related, but however, in terms of like sleep or lifestyle, in terms of stress at work, however, having stress at work, not eating well, not sleeping can possibly affect your blood pressure. If you suffer something like sleep apnea, where you don't have enough sleep, you can have issues with high blood pressure, which can affect your kidneys. But it is always good to try to get enough sleep, to eat a healthy, balanced diet, avoiding saturated fats, high sugary foods, and just overall getting some exercise in. Because again, what's good for the heart is also good for the kidneys.
Okay. Our next question is, there are people in my family with kidney disease from diabetes and high blood pressure. Does that mean I will have kidney disease too? Should my doctor screen me every year?
There's not a guarantee you will develop kidney disease, but you can have the risk. You have a risk factor. If you have a family history of people with kidney disease or diabetes and high blood pressure, you could be at risk for developing those diseases as well, and therefore that can also lead to chronic kidney disease. So depending on your age, you should see a primary care doctor at least once a year so they can go over your risk factors, check your blood work, check your blood pressure, check your cholesterol level to see if there's anything that needs to be adjusted or changed.
Okay. And this is actually an interesting question. Can stage 1 chronic kidney disease be reversed with diet, IV fluids with control?
If it's chronic kidney disease, unlikely, because it's chronic. So therefore you've had it for several months already. If it reverses, then it was probably acute kidney disease from some other issue that resolved. But chronic stage 1 kidney disease is very mild. It's not necessarily you're going to progress any dialysis in your lifetime, but it is a risk factor that you can have progression of your kidney disease. So it would be something that would need some follow-up, possibly at least once a year follow-up with either a primary care doctor or a nephrologist.
Okay. And at what stage does a patient need dialysis or a kidney transplant?
Stage 5 is usually when we start recommending someone start dialysis. But not everyone who gets to stage 5 needs dialysis immediately. Some people are not symptomatic at stage 5, but they should prepare for dialysis if that's something that they are able to do. I tend to refer my patients in late stage 4 for transplant evaluation, just because it does take time to get a transplant. There's many tests someone has to go through to be eligible for a kidney transplant. And the reason for that is that a transplant is major surgery, and the facility that's doing the evaluation has to make sure that you'll be able to go through that surgery and not reject the organ that's given to you. But for the most part, people in stage 5 kidney disease do require dialysis, or a discussion needs to be had about dialysis.
Okay, and another question that we have is, what are the different types of dialysis and how do they work? So
in this country, the most common was hemodialysis. It's a process where there's a machine that pumps your blood from you through a filter and passes it back to you again. And that helps remove the impurities that your body's making that your kidneys are not able to take care of anymore. In our country, it's done 3 times a week, for the most part, either a Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. Some people who are able to have this treatment at home, what they call home dialysis, and that's done several times a week, either 4 to 5 times a week, sometimes more, depending on the person's need. Another dialysis modality is called peritoneal dialysis. It's a process where there's a catheter placed in your abdomen, and that catheter allows a fluid to be fill your abdomen, and then that fluid stays there for a short period of time and is allowed to come out after a while. And you will repeat that several times a day, and that is your dialysis treatment for the day. They both have different benefits and things and reasons why people may choose one versus the other. But in our country, hemodialysis is more common. Outside of our country, peritoneal dialysis is probably a bit more common.
Okay, you actually got a shout out on YouTube. Yeah. It says, Serge Balmir, best nephrologist in Brooklyn, from Carmen.
Thank you very much, Carmen.
And we do have more questions. So we have another question from Marilyn. How does the emotional and psychological recovery process of kidney transplant impact their long-term health outcome?
I don't perform kidney transplant, but it is a life-changing thing for especially those that have been on dialysis, and now they're off dialysis. They're off that dialysis schedule, and they're able to take part of this gift that they've received. But it's not an easy thing to maintain a kidney transplant. So it's a lot of follow-up with different doctors, because some people who've gotten the transplant, they have other illnesses such as high blood pressure, diabetes, and now they're taking 6 or more medications to hold on to this transplant. So some people can feel a lot of stress because there's a lot of follow-up with doctors that need to happen, especially in the first year or 2 of the transplant, provided they have no significant complications. So it is important to have some support, and the transplant facilities can provide that support, as they are with you all the way through the process trying to get that transplant. But it's a big responsibility for both the patient and the physician to maintain that transplant.
Okay, that's very interesting. Well, this wraps up the episode of Healthcare Unlocked. Thank you for watching and for being a part of our show. Please don't forget to follow us on social media platforms. And if you have any questions or if you would like to know a little bit more about chronic kidney transplant, feel free to reach out to Dr. Balmir. You can find him at Doral Health and Wellness and Mount Sinai. Thank you. We'll see you next time.
Have a great day. Thank you so much.
The mic is on?
That's it's not a hot mic. People get in trouble.